Hello everyone, welcome to my YouTube channel. I am Nurse Patience. Today we'll be talking about hypertension in pregnancy. You would agree with me that hypertension for most individuals does not come with a particular sign for them. And also, if you are new to this channel, kindly hit the subscribe button, and also you're a returning viewer and you are yet to subscribe, do the same. Also, don't forget to like this video. Hypertension in pregnancy is one major complication or a pregnancy toxemia in pregnancy and needs to be paid attention to because you don't want a lot of complications to arise from a poorly controlled hypertension. Why is hypertension in pregnancy a problem? One of it is one, this can cause a decrease in the supply of nutrients to the placenta. By supply of nutrients, the blood that goes to the placenta tend to shorten for individuals that have hypertension, and also the oxygen supply that's supposed to go to the placenta would not get to the placenta. And we all know that the placenta is one basic system that the baby needs to survive while it's still inside the uterus. Another point why hypertension is a problem and needs to be paid attention to during pregnancy is it causes placenta abruptio. By placenta abruptio, it means this is a medical condition in which the placenta tend to detach from the wall of the uterus where it is initially attached to, and you wouldn't want that to happen. The implication for this is if the placenta detaches before time of delivery, there's high tendency of the baby being cut off nutrients, and also the baby will be delivered before time, and this can also be avoided. The next point here is it can cause organ failure to the mother and even to the baby. If hypertension is long standing without any form of attention paid to it, it then becomes a problem because it can affect the eyes, it can affect the kidneys, it can affect other vital organs too, making them to shut down. Another problem that comes with hypertension again is it causes low birth weight. For if not properly maintained, it causes low birth weight. Another of it is it causes intrauterine growth reduction. You wouldn't want to give birth to a baby that is not fully formed, and the weight of the baby, the expected weight, is not what you get when there's intrauterine growth retardation. And once this happens, the baby might tend to come out with maybe a very small skull, and a lot of abnormalities would also set in from that point. The next point here now is the types of hypertension in pregnancy. There are four different types of hypertension in pregnancy. One of it is the chronic hypertension. The chronic hypertension is the hypertension that develops before 20 weeks of gestation. By this, it could be that the individual had this hypertension before the pregnancy, or hypertension that develops before the 20th week of pregnancy. Usually, hypertension does not have a particular sign and symptom, so these individuals might not really notice if they are with hypertension. The next type of hypertension in pregnancy is the gestational hypertension. This is the type of hypertension that occurs or that develops after 20 weeks of pregnancy. That means it could be as a result of the pregnancy now that causes this hypertension. The next type of hypertension in pregnancy is chronic hypertension with superimposed preeclampsia. But chronic hypertension with superimposed preeclampsia, I already told you that chronic hypertension is the one that develops before the 20th week of pregnancy. And now, measuring chronic hypertension and with superimposed preeclampsia, it shows that that individual might have developed hypertension 20 weeks before the 20th week of pregnancy, and with signs, the individual is now having signs of preeclampsia. And preeclampsia, the one of the classic sign of preeclampsia is proteinuria. That's the individual has chronic hypertension, which then worsens the situation and giving the individuals signs of preeclampsia, which is proteinuria. The last and the final type of hypertension in pregnancy is preeclampsia. Preeclampsia is a chronic form, it's chronic hypertension that worsens the BP and also results to proteinuria and also signs of organ failure. We wouldn't want our patients or women to get to that before they take drastic decision. If you're having hypertension before you conceive or you're having hypertension in your pregnancy, you should always make out time to go for your antenatal visit so that your team of doctors will help manage you properly. And also, any drug you are giving your antenatal visit with regards to hypertension, you try and take it to help you regulate your blood pressure so that it would not lead to organ failure. The next item we'll be talking about as with regards to hypertension in pregnancy is the risk factors for exposing an individual or predisposing an individual to having hypertension while they are pregnant. One of it is age. By age, women that are older than 40 and are pregnant are of high risk of coming down with hypertension while they are pregnant. Also, family history. Individuals who have family members that while they were pregnant, they had a complication of hypertension, of a higher tendency of coming down with hypertension while they are pregnant. Another is history of chronic hypertension. This is hypertension that develops before 20 weeks of pregnancy. So, an individual who already has hypertension and is pregnant will definitely have this hypertension in pregnancy, which is the chronic hypertension. Another point here is for race. African Americans are of higher risk of having hypertension while they are pregnant. It has been statistically proven. Another risk factor is obesity, that's body weight now tends to have a play on developing hypertension while you are pregnant, because for individuals that are obese, they have the sedentary lifestyle, they are mostly not mobile, they tend to stay in one place, they feel relaxed, they feel overly comfortable, and they don't want to move. Another risk factor is individuals previous pregnancy that had issue of preeclampsia would definitely have preeclampsia in the next pregnancy. Let me explain. Your previous pregnancy, you had hypertension, and after you got delivered, it is possible that when you get pregnant the next time, you would also come down with hypertension in pregnancy. Then the signs and symptoms of hypertension in pregnancy. One of the signs and symptoms of hypertension in pregnancy is one, you have visual problem. The other is you have headache, constant headache that does not go away. The next is there's this swelling in your face, your hand. If you notice this sign, these symptoms, then you need to go meet your doctor. Then individuals with swelling of the leg too, they have swelling on the face, swelling on the hand, their hands are swollen, their face are swollen, their legs are also swollen. These are usually edema, collection of blood, of fluid on their body. So this is edema of there's edema of the leg, there's swelling of the face, and there's also swelling of the hand. Another sign and symptom is proteinuria. That's if you allow hypertension to get to preeclampsia, there's always a possibility that when you go to run a urine test, it is possible to find protein in your urine, and it's a very complicated, it is a very dangerous symptom of hypertension which should be paid attention to. Next, we'll be talking about is the complications of hypertension in pregnancy. Of course, there are a lot of complications that has to do with hypertension in pregnancy. I would mention a few in this video for us. One of it is there's low birth weight. By low birth weight, the expected or the average, the range of a normal birth weight for a baby is 2.5 to 4.5 to 4.0 kg. And if you're having less, below 2.5 kg, that means your baby have low birth, and it's something you need to pay attention to, because with weight at which you give birth to your baby is very important, because it helps them stand in the surrounding or the environment outside the uterus, because now they are solely independent in their heat generation and also in hemostasis around them. So with the birth weight now, it also have a hand in the number of adipose tissues that these babies have. And if they have very good adipose tissue, it will help them to regulate heat. That thermoregulation will be under good check for such babies. But those that have a low birth weight, they tend to deal with sort of factors, and one of it can be poor or poorly regulated thermoregulatory abilities. So such babies will not be able to regulate their temperature well. Most especially, they will be having cold distress. The next complication of hypertension in pregnancy is this organ damage. If hypertension in pregnancy is left unattended to, it will lead to organ damage. Example of this is liver. The liver tend to shut down, the kidneys, all the vital organs are affected if hypertension is not properly controlled. Another complication is placenta abruptio. I earlier discussed and I earlier defined that placenta abruptio is the sudden detachment of the placenta from the uterine wall, which is a danger, and this will come with lots of bleeding. So apart from placenta abruptio, individuals that have chronic hypertension and is poorly controlled would tend to have hemorrhage, and there will be blood loss, and there's high possibility of such an individual having anemia, which is the shortening. The blood that is in the body, it is not enough. So such an individual are predisposed to getting a transfusion. But the next complication here again is preterm delivery. You might just have to give birth to the baby before the 37th week of gestation. The next complication is intrauterine growth retardation. At this point, your baby does not tend to grow. It grows very little, very small, and you might even be wondering at the point of delivery, am I the one giving birth to this very little tiny thing? So you wouldn't want that. Also, it is intrauterine growth retardation is cause of the decrease in the supply of nutrients to the placenta. Once the placenta doesn't get enough, it cannot give what it doesn't have to the new baby. So the baby growth tend to be stopped or pegged at a particular level. Please, in this video, if you're watching this video now, you know someone, or you are the individual who has hypertension and you are planning on conceiving, or you are pregnant, please also always make sure you go for a routine check for your BP check, you take your BP drugs, and also ensure that you do a urine testing from time to time, so as to take away every doubt and to clear yourself from every form of proteinuria, because you will not want to get to a stage whereby this medical condition tend to affect your pregnancy. Also, one of the management of hypertension in pregnancy is the management of hypertension in pregnancy includes: one, regular antenatal visits. By regular antenatal visits, you tend to go for a routine check, because at this point, individuals that have hypertension in pregnancy, their pregnancy is already complicated by virtue of this condition. So you would not just have the normal routine check like not other individuals who have an uncomplicated pregnancy. At this point, you have to visit more often than you should. So please, you try and always book an appointment with your doctor, so that they will check your BP and also do the urine test and look for a way forward if there is any form of emergency that needs to be taken care of. Also, make sure you take your BP drugs so that your condition will not worsen. And because If your condition worsens, it might get to eclampsia, and eclampsia is very dangerous and is very deadly, such that it has there's chronic high blood pressure in it, there's proteinuria, and there's also seizure. And once this seizure happens, it affects the brain of the mother, and it also affects the brain cells of the newborn. You would not want to have this particular complication. So please avoid not taking your drug. Please always take your drug. The next management is the woman will have to give birth to the baby before time. So that the healthcare provider, her team of doctors would advise her that it will be better for her, for such a woman who has preeclampsia or chronic hypertension, to give birth before time to save herself from any form of risk or complication that may arise as she keeps the pregnancy for long, by saying that the woman will have to deliver before the 37th week of gestation. Then for most individuals, they tend to advise them not to do a normal vaginal delivery, but rather to go for a cesarean section, depending on the kind of condition and the kind of symptoms she's presenting with. If it's for preeclampsia with a very high blood pressure and proteinuria plus, she might be booked for an emergency cesarean section. So please, having said all this, you should bear in mind that hypertension in pregnancy is not the end of the world. After you give birth to your baby, there's high possibility that the way the blood pressure was high during your pregnancy, it can still be well controlled and you can still live longer and grow it with your children. So you need to take your drug, you need to do some exercise. You check my previous video on hypertension and see the management that was discussed there. So that, and you also need to avoid those stimulants too, so that you'll be able to have a longer and a healthier life, and also take your medication really serious. Please, if there's any question you want to ask, or there's something on your mind you want to talk about this topic of discussion, you can do that at the description section. Also, this video was not produced for only women who are pregnant, who women who are about to get pregnant, but it's also produced for students, nursing or medical students who might want to know more about hypertension in pregnancy. Please, if you had a good time watching this video, don't forget to like this video. And also, if you've not subscribed to my channel, kindly do that. Thank you so much.